Hi everyone, it's Dr. Jing Cao. I'm a family physician based in Toronto, Canada. So today I am here to give you an update, a very important update about cervical cancer screening in Ontario. This is going to happen starting from March 3rd, 2025. So we're switching from the pap test to the HPV testing. So over 99% of cervical cancer are caused by HPV infection. So HPV infection is a viral infection, and this kind of infection occurs through sexual activities. So who are we screening? We're screening people that have one or two cervices, okay? And so you need to have a cervix to be eligible for cervical cancer screening. And then you are at least 25 years of age and have a history of sexual activity. We have many different types of HPV strains. And so the three types that are known to cause cervical cancer, they are type 16, type 18, type 45. So I'm going to refer to them as a group as high risk, okay? And there are other HPV viruses, but they're not that highly associated with cervical cancer. And I'm going to call them as a group, they're the low risk HPV viruses. Okay, and so the big change for patient I think you need to know is that previously for pap test we start at age 21. For HPV testing, the starting age is going to be age 25. Okay, and another big thing is previously if you're healthy, you had a pap test and it was normal, then the repeat pap is going to be 3 years. So every 3 years, unless your test result is abnormal, you're going to have to repeat your pap test, okay? And that is all covered by OHIP. Now we're changing. So if you have a normal HPV testing and you are a healthy individual, then you are going to have a 5-year interval. So that's 5 years until your next cervical cancer screening. So I can already predict, and I actually have some family friends and who are coming to me and say, oh, this government's cutting funding. We used to have pap tests every year, and then it's every 3 years, and now it's every 5 years. The healthcare quality is going down. So I'm going to bust that myth, okay? So the healthcare quality has not came down in this instance, okay? The difference between pap test and HPV testing is pap test, you're looking for the changes that's already being caused by HPV viruses. So we're looking at the effect of the virus in your body, okay? Whereas the HPV test, we're looking for the presence of the virus. So you may have just came in contact with HPV and we're already detecting it, and your cells, they may look perfectly normal. They haven't had the viruses haven't had a chance to really damage your body at that point. So we're detecting at a very earlier stage. We're detecting the infection rather than the result of infection, okay? And so that's a benefit. Now let's go back to the major changes. So like I said, we're starting the test at a later age, at age 25. And we potentially, if you're healthy, you don't need to do cervical cancer screening until for 5 years, okay? So 5 years. But it's not for everybody. So for patients who are immunocompromised, which means they have HIV or AIDS, they have a living organ transplant, they have some sort of primary immunodeficiency, they are taking medications that's suppressing their immune system, maybe they have a chronic renal failure that's leading to requirement of dialysis, and finally, I think I'm missing another one. I'll list all the categories, okay? But if you're not in that category, your screening is every 5 years. If you are in the categories that I have mentioned, then you are going to screen every 3 years, okay? every 3 years, you're going to have HPV testing. Now, for patients, your experience for this test is exactly the same. We're doing this exactly the same test in the office. It's the same tools, exactly the same. So, but when you get tested, the lab is going to run a different test. Instead of doing pap test first, they're going to do the HPV testing first. So previously, if you want a HPV testing, you have to pay that privately. You have to pay it yourself. But now that is going to be covered. So everybody's going to get that test, HPV test. And if that test result shows that you don't have HPV virus, then you are going to either get a repeat HPV test in 3 years or 5 years, depends on your health status. Okay. Now, if you have HPV virus detected, then it's going to tell you if you're at you have one of the high risk HPV strains, number 16, 18, 45. If you're in that category, you go directly to colposcopy. Amazing, no waiting, okay? Go directly. And then if you have a low risk HPV virus strain, then you are going to not have to do a pap test, but the lab is going to run a pap test from the same sample that your doctor has collected from you, okay? And then with that pap test that they do with the same sample at that point, they're going to tell you if your cells, your cervical cells, have been affected by the virus. If we see some milder changes, then we're gonna bring you back in 2 years, okay? In 2 years to repeat the HPV testing. So not 3 years, not 5 years, but 2 years, okay? But if your pap test is a high risk change, okay? That means your viruses that was detected by HPV has then been shown in your pap test that has caused significant change to your cervical cells. Then you're going directly to colposcopy. Again, no wait, immediately go to colposcopy. So it is a much better, more efficient testing pathway for our patients. I think this is better patient care. So don't fall into the the thinking of, because you hear some people are getting every 5 years, you're getting ripped off, you're getting worse healthcare. It is not the case in this situation, okay? I want to reassure patients this is a better method of testing for sure. So going back to my point of 1 or 2 cervices, did you know that some women can have more than 1 cervix? And if that's the case for you, you need to let your doctor know, because when they're doing the test, they need to test each one individually, and they need to label the samples from the left or the right, okay? So that is kind of interesting. And some women don't have cervix because they've had hysterectomy. So if you had a complete or total hysterectomy, then you do not have a cervix anymore, and you most likely wouldn't get cervical cancer. So you don't need to do the screening anymore. But if you only had a partial hysterectomy, which means the cervix is left behind, okay, you still have it. In that situation, you should still get cervical cancer screening. So please do look into your record and make sure you and your doctor are aware of your medical history so they can make appropriate decision about whether you should be tested and when you should be tested and all that information. Anyway, so I hope this is helpful. I hope I was able to reassure you. And if you have any more questions about HPV, cervical cancer, any of these related questions, then leave a comment below and I will try my best to answer you. And if you're my patients, ask me anything in the office. I'll try to explain to you. And like I said, I'm doing these videos so that I don't have to repeat these basic information to patients over and over, so I can free up the time to answer questions that are specifically for you, okay? And I want to warn my patients about just looking online and looking for like information that are not specifically to you. Just because you hear something online that may apply to you, you need to talk to your physician who knows you, who have your health record in front of them and you in front of them to get specific information about you, to give you the right diagnosis, to give you the right advice. So please don't just search for information and apply to your health, okay? Ask a professional to help you guide through these important decision making, okay? All right, have a great day, guys. Stay healthy. And if you want to have more information like this, please consider following me, okay? Take care.